Welcome. Thank you for attending my poster presentation on clinical nurse leader orientation pathway development. This poster was created to showcase the work completed during my professional practicum, course NU 660, taught by Dr. Kathy Homart. My name is Michelle Ross. I'm a nurse manager at Unity Point St. Luke's in Cedar Rapids. I've worked at St. Luke's since I was a new grad nurse 17 years ago. I have spent the past 10 years working in leadership and am now at the conclusion of my MSN program with an emphasis in nurse administration. When considering a final project, I worked with my preceptor to identify a current need. While we continue to work to enhance the care teams across our health system, we've been able to add additional resources at the bedside to support new staff and leadership. One of those roles is the clinical nurse leader, also known as a CNL. St. Luke's Hospital currently has 4 CNLs on staff, 1 in our intensive care unit and 3 on our surgical specialty unit. Position requirements are a Master's of Science in Nursing preferred or current enrollment in a Bachelor of Nursing program. There is not currently a CNL-specific orientation pathway or checklist, and we do plan to expand to all acute areas by the end of 2024. When looking at the evidence and literature, I found that the CNL role was first introduced in 2003 by the American Association of Colleges of Nursing, the AACN. The role is to be a generalist, to be MSN prepared. They're to function within a small frontline team, and they are to focus on care delivery and outcomes, utilizing research and providing care, and frontline education and mentoring. Further review of literature supports the continued utilization of CNLs. They have a lot of support on the units towards quality improvement initiatives, collaboration of care between disciplines, and implementation of evidence-based practices. A similar role to the CNL is the Nursing Professional Development Practitioner, or NPD. These can be BSN prepared. They're outlined role by the American Nurse Association and the Association of Nursing Professional Development. They focus on diversity, equity, and inclusion, and they improve professional practice through teaching and mentoring. Gaps and barriers were identified when I started this project. There were gaps in our orientation pathway, and I evaluated these through a survey of our current CNLs. I found variability in the following areas: length of orientation, available preceptors, post-orientation follow-up, and understanding of roles and responsibilities. Barriers that were identified was this was a new role to Unity Point Health St. Luke, so we did not have trained preceptors. The role was designed for an MSN prepared nurse, but we lacked MSN applicants. There was a comfort level variation between current CNLs based on their tenure, their background, and their level of completed education. Some are master's prepared, some are enrolled in a BSN program. And there's some standardization of roles existing, but that was being utilized specific to the unit needs at the manager's discretion. So the plan is to standardize this through the utilization of a created skills checklist and pathway. The CNL team is having regular meetings with the Professional Practice Development Manager, and she has completed a needs assessment for targeted education topics that will be ongoing for the current CNLs and all future CNLs. And by the AACN's definition, a CNL should be an MSN prepared nurse. So we're doing some enterprise-wide collaboration to occur on continued role development. We may need to consider changing names or job descriptions to align with the nursing professional development practitioner role versus the CNL role in the future. But really the vision remains the same: patient-centered care, teamwork, the utilization of evidence-based practice, and improvement in quality. And all are accountable for outcomes and promotion of evidence-based practice. So I worked with a group of key stakeholders to create a competency-based orientation checklist and pathway. Those stakeholders were our current CNLs, our professional practice development manager, our acute adult manager, our nursing operations director, and our advanced practice nurses. The skills checklist topics include staffing, recruitment and onboarding, compliance, quality and risk, human resource topics, and leadership and professional development topics. The pathway includes a proposed timeline of 3 weeks of orientation, identified preceptors, targeted education and orientation experiences, shared governance council attendance, and many professional development opportunities. To evaluate, we will continue to monitor metrics, including first-year turnover, engagement, patient satisfaction, and hospital-acquired infection rates, all areas that the literature supports should see improvements with the use of a CNL on staff. And then we'll continue ongoing education and mentoring of our CNLs through our post-hire touchpoints and post-hire surveys. I appreciate you listening today to my poster presentation, and thank you very much.